We are back on Taking Care of Business on Koerner Radio, News Talk, 1180, 1230 KGEO, and 1410 KERI. Our guest by phone is author and president of the Pacific Research Institute, Sally Pipes.
One of our favorite guests.
Yes, very favorite guests. A fellow Canuck. Sally, question for you. I know you've touched on this, but if you were, say, a CFO of a company of about 100 employees, can you kind of recap what your world is going to look like in the next couple of years and what you need to worry about?
Right. Well, I think, any employer with 50 or more employees is going to be subject to the employer mandate. And, this country is built on entrepreneurship. But, when you look at, the options, I think a number of employers are going to say, we are paying, on average, for a family of four, roughly, $16,000 a year for our employees' health insurance. And it's going to only get more expensive by adding, children being able to stay on their parents' plans till age 26, the ending of discrimination based on pre-existing conditions. All of these things are going to increase the cost of health insurance. So in my mind, it is no wonder that Deloitte, McKinsey, former CBO head are saying that, up to a third of employers are going to drop their employer-based coverage and pay the $2,000 or $3,000 per employee fine so that employees can get their health care in these exchanges. I mean, I don't know if you saw it, but yesterday McDonald's, the hamburger chain, their CFO came out and said that they estimate that they are going to, the Affordable Care Act is going to cost them and its franchisees more than $400 million a year in additional health care expenses because of the law. And so we're going to see these numbers coming out often, and as a result, I think employers are going to say, if we want to stay in business, we cannot afford to pay these tremendous cost increases. So once again, the president, if you like your health insurance and you like your doctor, nothing will change. Well, things are already starting to change as business leaders realize, what this means for them.
What about Medicare? What are some of the changes or rules, restrictions, requirements that these poor seniors are going to be facing?
Well, that is a very important issue because, in the Affordable Care Act, the president wanted to add 18 million people to Medicaid, the program for low-income Americans, by 2019. So how do you add, 18 million more people to Medicaid? Well, they were going to take $500 billion over the decade out of Medicare to pay this big Medicaid expansion. Well, the Congressional Budget Office came out yesterday in their analysis of the impact of the Supreme Court decision on whether or not the states are forced to expand their Medicaid programs. And they said now Medicare is going to have to be cut by $741 billion over the decade, which, $200 billion is not small change. And so this is going to be very detrimental to our seniors because they're going to find it increasingly difficult to find doctors. And we already know that 1 in 3 Medicare eligibles are already having a hard time finding a doctor because the reimbursement rates for doctors are much lower than what they get for treating private insurers. It's roughly 20%. So a further reduction in federal funds for Medicare is going to be very detrimental to our seniors. And this was a big revelation yesterday, $741 billion cut over 2012 to 2022.
Well, they're going to make that up. They've got this 3.8% tax that you're aware of in the bill as well.
Right, the new Medicare tax on interest, dividends on unearned income, which kicks in January 1st, 2013. That tax will be placed on individuals earning $200,000 a year and couples earning $250,000 a year. It will also be charged to the capital gain on your home over the basic exemption. So this is a huge new tax, and also next year, January 1st, 2013, the new 2.3% excise tax on medical device companies comes into being, and we've already seen companies like Stryker in Michigan say they're letting 1,000 people go. A number of other companies, Cook Medical, is not going to expand now in the U.S. Zimmer is taking a big write-off. I met a board member of a medical device company on Monday who said this is the first year that their small medical device company is profitable. But next year, because of the excise tax, they're going to go back into the red. And, if we don't have research and development, innovation in pharmaceuticals and medical devices, who does it harm? It harms patients not only in America but around the world, because the United States is the country where the innovation and R&D has been done for many, many years because we don't have price controls. But these new taxes are really going to be very, very bad for the future of these industries. And these are industries that create jobs for the American people.
It's definitely going to kill that market. We're having a conversation with author and president of the Pacific Research Institute, Sally Pipes.
Sally, another issue that I keep hearing about, and I'm a little concerned about, is the life and death program.
Don Berwick, who was a recess appointment to head up the Centers for Medicare and Medicaid Services, he was never officially appointed, so he's out now. But, he was a great fan of NICE, the program in England, the National Institute for Health and Clinical Excellence, where government makes decisions about, what treatments and procedures patients can receive. And so they do a quality-adjusted value of your life and say, Marty, they determine that you're worth $50,000 a year, and yet your doctor says you need, a new drug like Herceptin or whatever, and it's going to cost $60,000 a year. You wouldn't be eligible for it because the value of your life is lower than the cost of the drug. Don Berwick is a great supporter of that. I think under the Affordable Care Act, the Patient-Centered Outcomes Research Institute is really going to be doing similar things unless this act is repealed and replaced, because costs are going to be out of control. And so, this is really our seniors are the people who, have the most health care expenses. But in order to keep costs under control, you will ration or deny care. And I think these decisions should be made by doctors, patients, and their families, not by bureaucrats, and particularly under the new Independent Payment Advisory Board, where the federal government will be appointing, 15 members who will be making decisions about how much doctors and hospitals can be paid. So I think it's the whole thing is very bad for we do live on average in America 79.5 years, and we do have the very best in healthcare. We have a few problems, but we know how to fix those problems, and their solutions are all in my book. But this is very serious when government starts making decisions rather than doctors, patients, and families.
Well, seniors are a drain on society and have no value when you compare it to a younger person, and so we need to get rid of them. That's how I read the bill.
Yeah, exactly. No, I mean that is precisely, and in a country like Canada and Great Britain, denying care to people because they aren't, they're not considered to be valuable producers for the economy. You cut your costs and you can keep the share of gross domestic product in Canada at 11.4 or 5% because you're not spending money on costly treatments for our seniors. And I think this is it's a very serious thing, but it is part of I don't like to talk about death panels, but we're definitely looking at in the future ration care and care being denied.
Well, here's something I found very interesting. The question was, why do the ages of our world's greatest civilizations average around 200 years? And the answer was, why do these civilizations all seem to follow the same identifiable sequence? From bondage to spiritual faith, from spiritual faith to courage, from courage to liberty, from liberty to abundance, from abundance to complacency, from complacency to apathy, from apathy back to dependence, and finally from dependence back into bondage. That's the direction the United States is going.
Well, certainly, if you look at it, we are, becoming an entitlement society. And in order for people to have these programs that they feel they are entitled to, people have to work and generate production and jobs in order to pay taxes to fund these. But if we become a society where more people are dependent on government than there are producers, a nation is not, there's no guarantee that a nation is going to be great forever, and nations come and go. And I think, President Obama, his ideological vision for our society, his vision is that Americans cannot make decisions for themselves, that government should be in charge of making decisions for us. And this is a terrible idea, but it'll be really lead to the downfall of this great nation.
What about waivers? I understand that there's religious waivers and the Muslim community does not have to participate.
Well, under Obamacare, because most of the cost drivers don't go into effect till 2014, a number of companies and unions said, we offer these mini-med plans, and, under the new changes for the ceiling on what insurers have to cover, we're not going to be able to provide our mini-med plans, particularly the McDonald's of the world, restaurants. So 1,700 waivers were granted between last year and 2014 until the exchanges are coming into effect. And, I thought, about half of the waivers were granted to unions of all things. And Nancy Pelosi in San Francisco, a lot of the waivers were granted to her friends who run restaurants here. It is true that some of the religious organizations have been told that they don't have to comply with Obamacare,
Yeah.
and so but it's not clear exactly how that all is going to end up. But certainly, I think by granting 1,700 waivers, it shows that the Affordable Care Act was not sustainable and it's not cost effective. And so I really think it was kind of interesting that waivers had to be granted.
Definitely, Sally. Unfortunately, we're out of time. We need to have you come back soon.
Absolutely. Thank you both, Clay and Marty.
Have a great day. Have a great day.
Bye.
We'll be back at 167 hours on Taking Care of Business on Koerner Radio, News Talk 1180.